they didn't think Quinn would make it past 2. And that's a really hard thing for a parent to hear. Some days are the best anyone can imagine. And some days are awful. That's our reality. That's Quinn's reality. But she is one tough cookie. I'd put her up against anybody.
We first found out she was deaf. We thought, oh my gosh, this is so tragic. And now that's so minuscule.
Around the 3 months of age, she had the head lag of a newborn baby still. She just wasn't able to hold her head up. And then around 5-6 months of age, she started having what I would call these startles. She looked like someone was literally scaring her to death. Eventually, what came to fruition was that she had infantile spasms, which is a form of seizures, epilepsy. Quinn has what they call severe dystonia and opisthotonos. And it started when she was probably 6-8 months old. It comes from a neurological place. What that looks like is just picture someone arching backwards and being so tense that you can't move her.
So that's when we started doing the genetic testing, and we found out more information on her and what kind of is, and the puzzle started coming together.
There are, as we know right now, I believe 30 cases worldwide somewhat like Quinn. So through genetic testing, we found that Quinn was part of a rare genetic disorder, and I call it a SPATA5, S-P-A-T-A-5. It's so rare that there isn't a name for it yet. And Quinn was actually part of the first published medical journal regarding this rare genetic disease. It was getting to a point where Quinn's organs were starting to fail because they were flushing so much medication through her little body. And we had to do something, and we thought we were gonna lose her. That is where the amazing providers, the specialists here at the Children's Hospital came in. They started putting their heads together, and they had heard of this world-renowned neurosurgeon was working with malnourished children, placing baclofen pumps, which look like giant hockey pucks, in the bellies of these children. Quinn is the first and smallest at the University of Iowa to have the baclofen pumped, placed in her belly. It was amazing. It's literally saved her life. She went from arching, almost in pain, almost 24 hours a day on these drugs that were harming her body, to being able now to sit in a wheelchair by herself for long periods of time, to stand in a kid walk and actually take a step. The one thing that's really helped our situation and Quinn's prognosis is the team. Quinn has seen so many specialists. I don't know if I could count them all on both hands. Quinn is a rarity in the sense that it's not just one thing that she has. It's several things, and they all interconnect. We have taken Quinn to other places and seen other people. And I can tell you 100% that this hospital, they worked with us, they've listened to us, and they've listened to each other. She is in such a better place, and that is due to the Children's Hospital here. That is due to the amazing people, the amazing doctors that didn't say no and walk away. They didn't give up, and we are forever grateful for that.